Yeah, that's not me.
Happy मकर संक्रांति.
तिळगुळ गोड बोला.
तिळगुळ घ्या गोड बोला.
बोला.
हा 2022चा आपला पहिला कार्यक्रम आहे आणि सर्व लोकांना नवीन वर्षाच्या शुभेच्छा आणि मकर संक्रांती निमित्त सर्वजण तिळगुळ घ्या आणि गोड बोला. आपण मागच्या वर्षी एक हेल्थ सिरीज चालू केली होती. त्याच्यामध्ये वेगवेगळ्या प्रकारच्या स्पेशलिस्टने आपल्याला माहिती दिली होती. तर त्या सिरीज मध्ये हा आपला आजचा 6वा प्रोग्राम होणार. तर आजचा आपला प्रोग्राम सुरू करण्यापूर्वी आपल्याकडे एक पाहुणे आलेले आहेत पुण्याहून. त्यांची मी 1 मिनिटात ओळख करून देतो आणि त्यांना 2 मिनिटं बोलायला सांगतो. आणि त्या बोलणार आहेत ते म्हणजे हिंदुस्थानामध्ये कोविड झालेला होता, हे दुसऱ्या ठिकाणी जगामध्ये झालेला आहे. तर त्याचा सामना हिंदुस्थानामध्ये कसा झाला किंवा होतोय त्याची आपल्याला थोडक्यात माहिती देणार आहे. तर आपले ते पाहुणे आहेत त्या डॉक्टर स्मिता जोशी, त्या पुण्याच्या आहेत. त्यांची स्पेशालिटी प्रिव्हेंटिव्ह ऑन्कॉलॉजी आहे. त्या स्वतः MBBS आहेत पुणे युनिव्हर्सिटीच्या आणि कॅन्सर मध्ये त्यांनी रिसर्च करून PhD पण त्याची मिळवलेली आहे. तर पुण्याला डेक्कन म्हणजे रोडच्या पायथ्याशी एक प्रयास म्हणून नॉन प्रॉफिट NGO आहे, तिथे ते काम करतात. आणि या व्यतिरिक्त जहांगीर हॉस्पिटल आणि रुबी हॉल क्लिनिक त्यांची जी काय रिसर्च प्रोजेक्ट्स आहेत त्याच्यावरती पण ते काम करतात. तर त्यांना मी 4 शब्द सांगण्याबद्दल आमंत्रण देतो. Smita, you are there. Can you put your video on?
Yeah. गुड आफ्टरनून सगळ्यांना. आणि मुलगुंड सर, तुम्ही मला आज तुमच्या सगळ्यांशी भेटण्याची संधी दिली त्याबद्दल धन्यवाद. सरांनी सांगितल्याप्रमाणे मी पुण्याला प्रयास म्हणून जी नॉन प्रॉफिट ऑर्गनायझेशन आहे तिथे मी सर्वायकल कॅन्सर प्रिव्हेन्शन, ब्रेस्ट कॅन्सर स्क्रीनिंग आणि कोलोरेक्टल कॅन्सर स्क्रीनिंग वरती जे काही आमचे रिसर्च प्रोजेक्ट्स आहेत ते मी बघते. आणि इन ॲडिशन आमचा सर्वायकल कॅन्सर स्क्रीनिंगचा एक मोठा प्रोग्राम आहे. सर्वायकल कॅन्सर म्हणजे गर्भपिशवी तोंडाचा कॅन्सर, जो माझा सगळ्यात जास्त जिव्हाळ्याचा विषय आहे. आणि आमची एक मोबाईल स्क्रीनिंग युनिट आहे जे वेगवेगळ्या कम्युनिटीज मध्ये जाऊन आम्ही लो आणि मिडल इन्कम ग्रुप मधल्या बायकांची तपासणी करतो. ही फ्री असते. वेगवेगळे जे डोनेशन्स प्रयासला मिळतात त्याच्यातर्फे हे प्रोग्राम्स सगळे फ्री केले जातात. आणि ह्या मोबाईल स्क्रीनिंग युनिट मध्ये आम्ही जवळजवळ 22,000 बायकांची आतापर्यंत तपासणी केली आहे. आणि त्याच्यावरती जे प्री कॅन्सर्स असतील त्याच्यावरती फ्री ट्रीटमेंट, त्याच्यावरती कॉल्पोस्कोपी, बायोप्सी आणि एक्सिजनल ट्रीटमेंट, जी काही जी ट्रीटमेंट असते प्री कॅन्सरसाठी ती पूर्णपणे या प्रोजेक्टच्या अंतर्गत फ्री दिली जाते. इन ॲडिशन मी जहांगीर हॉस्पिटल आणि रुबी हॉल क्लिनिक यांचं जे रिसर्च युनिट आहे तिथे HPV वॅक्सिन स्टडीज जे काही चालू आहेत, गर्भपिशवी तोंडाचा कॅन्सर होऊ नये म्हणून जे वॅक्सिन आहे तो जे सध्या उपलब्ध वॅक्सिन आहे त्याच्यावरती इंटरनॅशनल एजन्सी फॉर रिसर्च ऑन कॅन्सर ऑफ द WHO यांचा एक मल्टीसेंट्रिक स्टडी सुरू झाला होता 2009 मध्ये. तर तो मी जहांगीर क्लिनिकल डेव्हलपमेंट सेंटर मध्ये च्या थ्रू मावळ तालुका जो आहे पुण्याच्या तिथे आम्ही 3,000 मुली एनरोल केल्या आहेत. आणि भारतभर याच्यामध्ये 17,000 पेक्षा जास्त मुली सहभागी झालेल्या आहेत. आणि रुबी हॉल मध्ये मी सिरम इन्स्टिट्यूट ऑफ इंडियाने जे HPV वॅक्सिन बनवलंय त्याचा जो स्टडी आहे फेज 2-3 स्टडी तो मी लीड करते. COVID-19 बद्दल जर का भारतातली सिच्युएशन सांगायची झाली तर आजच मी न्यूज वाचली की ॲटलिस्ट 70% ऑफ द इंडियन्स हॅव रिसिव्ड 2 doses of the vaccine and at least 90% of the Indians have received 1 dose of the COVID vaccine. तर ही खूपच रिमार्केबल अचीवमेंट आहे if we consider the population of India, huge population of India. आणि ह्याची जी फर्स्ट वेव्ह होती त्यावेळेला सगळ्यांच्या मनात खूप भीती होती आणि त्यामुळे डिस्क्रिमिनेशन अगेन्स्ट डॉक्टर्स, अगेन्स्ट पेशंट्स अशा काही घटना झाल्या. मायग्रंट्स पॉप्युलेशनचं जे मायग्रंट्स होते, डेली वेजेस वर्कर्स होते, त्यावेळेला सडनली लॉकडाऊन डिक्लेअर केल्यामुळे त्या लोकांचे अतोनात हाल झाले फर्स्ट वेव्ह मध्ये. आणि त्याच्यानंतर हळूहळू सावरलं. सेकंड वेव्ह जेव्हा आली त्यावेळेला डेल्टा व्हेरियंटमुळे ती खूपच रॅपिडली स्प्रेड झाली आणि सिव्हिअर डिझीज मुळे जे काही हॉस्पिटलायझेशन झाले, जे काही रिक्वायरमेंट्स होत्या त्यावेळेच्या, तर त्यावेळेला हॉस्पिटलची परिस्थिती खूपच क्रिटिकल झाली होती. म्हणजे हॉस्पिटलमध्ये बेड मिळण्यासाठी, ऑक्सिजन बेड मिळण्यासाठी, व्हेंटिलेटर बेड मिळण्यासाठी, इव्हन पुण्यामध्ये सुद्धा खूप प्रॉब्लेम्स येत होते. ऑल्दो गव्हर्नमेंटनी बरेच, म्हणजे इंजिनिअरिंग कॉलेजला कोणाला माहिती असेल तर त्यांचं जे मोठं ग्राउंड आहे तिथे मेकशिफ्ट हॉस्पिटल तयार केलं होतं. इनफॅक्ट फर्स्ट वेव्हच्या वेळेला जेव्हा स्पेनमध्ये, इटलीमध्ये, फ्रान्समध्ये जे मेकशिफ्ट हॉस्पिटल्स बनवले होते ते आम्ही बघत होतो, पण ते ऍक्च्युअल अनुभवायला मिळालं सेकंड वेव्हच्या वेळेला. त्यावेळेला बेसिकली नॉर्थ इंडियामध्ये जे काही झालं दॅट वॉज रिअली हॉरिबल, विच कुड हॅव बीन प्रिव्हेंटेड टू सम एक्सटेंट. आणि तुम्ही त्याचे टीव्हीवरती न्यूज बघितले असतील. सध्या थर्ड वेव्ह चालू आहे, त्याचे केसेस वाढता आहेत डेली. पुणे जिल्ह्यामध्ये बघायचं झालं तर दिवसाला 10,000 साधारण नवीन केसेस आहेत. त्यातले 6,000 पुणे सिटीमध्ये आहेत आणि 4,000 रुरल पार्ट ऑफ पुणे मध्ये आहेत. पण त्याच्याबद्दल चांगली गोष्ट अशी आहे की सिव्हिअर डिझीज फार कमी होत आहेत. इट्स अ माइल्ड डिझीज आणि 2-3 दिवसामध्ये इट गेट्स, पीपल आर ऍक्च्युअली फीलिंग बेटर आफ्टर 2 or 3 days. तर आता मी या मंथ एंडला मी परत पुण्याला जाईन, त्यावेळेला मला असं वाटतंय की तो पीक रीच झालेला असेल थर्ड वेव्हचा. आणि so that is it so far about the COVID situation in India.
ओके,
Thank you.
ते छान. म्हणजे तुम्ही इथे येऊन आमच्या झूम मीटिंग मध्ये सहभागी झालात त्याबद्दल रिअली थँक्स. आणि आम्ही हिंदुस्थानामध्ये ऐकतो की नॉन प्रॉफिट ऑर्गनायझेशन खूप काम करतात, तर असंच काम करणाऱ्या कुठल्या तरी व्यक्तीला प्रत्यक्ष भेटणं हे फार महत्वाचं आणि भाग्याचं असतं. सो थँक्स फॉर प्रोव्हाइडिंग ऑल द इन्फॉर्मेशन अबाउट, अगदी थोडक्यामध्ये माहिती दिली. तुमच्या हॉस्पिटलचं जे सगळं काम चालतं तुमच्या बाबतीमध्ये रिअली कमेंडेबल. सो ऑल द बेस्ट. तुम्ही आमच्या उरलेली जी मीटिंग आहे फुल पार्टिसिपेशन. तुम्हाला जर काही प्रश्न असतील ते पण तुम्ही विचारायला हरकत नाही. सो थँक्स व्हेरी मच.
थँक्यू सो मच. मी प्रयासचं सगळं काम सांगितलं नाही, मी फक्त जेवढं काम मी बघते त्याच्याबद्दलच सांगितलं वेळेअभावी. पण तुम्ही कोणीही पुण्याला कधी आलात तर नक्की भेटायला मला आवडेल.
आणि एक माहिती सांगायची म्हणजे आपल्या इथल्या लोकांच्या करता की स्मिताने जे प्रयास हॉस्पिटल NGO म्हणून सांगितलेलं आहे, तर ते जे NGO आहे ते जी व्यक्ती बघते ती व्यक्ती विनय कुलकर्णी, तो माझा मावस भाऊ आहे. तर त्याच्या कामाबद्दल मी खूप ऐकलेलं आहे. ते डर्मेटॉलॉजिस्ट आहेत. तर थँक्स स्मिता. सो सी यू इन पुणे समटाइम.
थँक्यू सो मच.
ओके, आता आपण पुढच्या कार्यक्रमाकडे वळूया. आपलं जसं वय वाढत जातं तसं तसं आपल्याला खूप नवीन मित्र भेटतात. मित्र म्हणजे खरे शत्रू असतात ते, परंतु त्यांना आपल्यामध्ये सामावून घ्यावं लागतं आणि त्यांच्याबरोबर आयुष्य काढावं लागतं. तर अशाच एका मित्र शत्रूपैकी म्हणजे आर्थरायटिस. हा प्रत्येकाला केव्हा ना केव्हा तरी त्रास देऊन जातो किंवा त्रास देत असतो. तर त्या संदर्भात बोलण्यासाठी आजच्या वक्त्या आहेत मनीषा मुळगुण. अर्थात मुळगुण म्हणून नाव ऐकल्यानंतर पहिल्यापासून लोक विचारतील मनीषा मुळगुण म्हणजे तुमची कोण. तर माझ्या चुलत भावाची नातसून. तर त्याची आता योग्य प्रमाणे ओळख करून देण्यासाठी मी शशी जोगळेकरांना विनंती करतो.
नमस्कार. यापूर्वी मुळगुण नावाची मला ठाऊक असलेली एकमेव व्यक्ती होती ती म्हणजे श्रीराम मुळगुण. आज त्यात भर पडली. आजच्या प्रमुख वक्त्या आहेत हॅमिल्टन रहिवासी डॉक्टर मनीषा मुळगुण. त्यांची थोडक्यात ओळख ती अशी: मूळ वैद्यकीय शिक्षण मुंबई युनिव्हर्सिटी 1998, स्पेशलिटी ट्रेनिंग मॅकमास्टर युनिव्हर्सिटी हॅमिल्टन 2007 ते 2011. इतर आवडी वाचन आणि प्रवास. याशिवाय त्या अँकास्टर येथील रोटरी क्लब शाखेच्या सभासद आहेत व समाजकार्यात सहभागी असतात. त्यांना मराठी, हिंदी, गुजराती आणि कच्छी अशा 4 भाषा अवगत आहेत. हल्ली संगणकाच्या मदतीशिवाय काही करणे कठीण झाले आहे. संगणकाने शिक्षणाचे बरेच मार्ग सोपे केले आहेत. संगणक हे ज्ञान पसरवण्याचे मुख्य साधन झाले आहे. डॉक्टर मनीषा मुळगुण त्यांच्या आर्थरायटिस प्लस पेशंट या ॲपच्या वापराने पेशंट्सना बरीच माहिती पुरवतात व त्यामुळे योग्य वेळेस डॉक्टरशी संपर्क साधण्यास मदत होते. स्वतःची प्रॅक्टिस, क्रिएटिव्हली हॉस्पिटलचे कॉल, घरातील इतर जबाबदाऱ्या आणि सतत आवश्यक असलेला असा अभ्यास हे सर्व पार पाडत असताना दिवसाचे 24 तास कमी पडत असले तरी त्यांनी आज सिनियर फॉरमसाठी मुद्दाम वेळ काढला आहे. बरेचसे आजार संपूर्णपणे घालवणे शक्य नसते, पण त्यांच्या वाढीस थोपवायचे मार्ग असतात. सर्व आजारात वैद्यकीय सल्ला, मदत आणि रुग्णाचा सक्रिय सहभाग या तिन्हींची आवश्यकता असते. कार्यक्रमाचे सूत्र मी पुन्हा श्रीराम मुळगुण यांच्या हाती सोपवतो. नमस्कार.
All right, so I'm going to start my presentation, but a few things. Thank you so much for this opportunity. It's a pleasure to see so many Maharashtrians all together. And finally, I can connect with you guys and teach you some basics of arthritis and how to live better. I wish my Marathi was as good as everybody here. It's quite okay, like Bombay style Marathi. So I'm not going to speak Marathi at all. I'm going to start this presentation, but remember 2 things. I'm just teaching you what you need to learn. This is not medical advice. This is just something that I think is useful for anybody who is in pain and who has arthritis. And this is a very, I've taken a lot of information from a lot of websites and videos are there. So if there's a time crunch, you can look at these videos later on. You'll have the presentation for yourself. So I would ask Sriram Kaka to tell me how much time we have and maybe give me like a 10-minute notice so then I can wrap up properly.
There is no time limit. You just
okay. All right. So, and you guys can tell me if there's too many videos and, you know, we want to like skip it, then we can go for it. I'm very open to all of that. So let's begin. And namaskar to everybody and happy Makar Sankranti. All right. So Arthritis Plus Patient, I mean, that's an app I made, but it's basically all about you guys. I'm just going to get rid of this window here. Okay, so what is arthritis? It's a complex disease of the joints where there is swelling and tenderness of one or more joints. Main problems with this is joint pain and stiffness, and it usually worsens with age. It affects mobility, quality of life, your well-being, and ability to be in the workforce. And for you, your enjoyment during retirement. How common is arthritis? Actually, it is very common. 6 million Canadians and 1 in 5 adults have arthritis. And you having arthritis is not just your problem. It's also affecting people around you, your friends, your caregivers, everybody who's engaging with you. So arthritis strikes many ages, from infants to adulthood to like 60 and 80-year-olds. So it can happen anytime. Who gets arthritis? So as I said, it can be in infants, it can be in adults, it can be in the older age groups. So most of the things are from genetics, right? Good genes, your parents did well and they had arthritis, then likely you will get it. If they didn't have arthritis till much later part of their life, so won't you. Age, as we get older, it happens more often. Almost half of people over 65 can have arthritis. Smoking is a big trigger, and that's more so for inflammatory diseases like rheumatoid arthritis, not so much for osteoarthritis. Being overweight is bad because your lower part of your body, your knees, your ankles, your hip take all your weight. So those joints get affected more in people who are obese. And in Canada, arthritis is more common in women than men. 1 in 4 women or 1 in 6 men. I mean, 1 in 5 is average. So just being a woman makes it a little bit even worse for us. So 100+ arthritis. So really, that's a lot to talk about or think about, but we are going to talk about the most common one, which is osteoarthritis. And I'm trying to simplify this into an inflammatory arthritis or a non-inflammatory arthritis. Inflammation is like from within, there is swelling and inflammation and cells that are causing all those things. And osteoarthritis is traditionally called the wear and tear arthritis, but that's not completely true. There is some inflammatory component to that. And sometimes the inflammatory component is a bit more in some patients than others. The other types of arthritis that you may have heard of is rheumatoid arthritis. Then there is gout, which is uric acid crystals, more common in patients with kidney failure. Pseudogout is calcium pyrophosphate crystals. Psoriatic arthritis is the one that's associated with psoriasis. If anybody that you know, or if any one of you has psoriasis, there's a 30% chance you might have psoriatic arthritis. And then there is a spondyloarthritis, which is axial and peripheral. That means it can affect your back or your joints. And that's more common in people under the age of 45. And then there is post-viral arthritis. You get a flu, or some people get COVID or whatever, and then they start to have joint pains after that. Then there is lupus-related arthritis. There's arthritis related to Crohn's disease, ulcerative colitis. So we can go on. The list is extensive. What I want you to remember is the difference between inflammatory arthritis, inflammatory pain, and mechanical pain, because the treatments are completely different. And sometimes you may have osteoarthritis for a long time, and then another arthritis like rheumatoid may hit you, and then you don't know if this is something that you should talk about it to your doctor or you don't. Is it the same thing or is this different? So we'll just learn a few things. So some questions you need to ask yourself. Where does it hurt you and how long? When does it hurt you the most? With activity, at rest, or both? So with activity, mostly the inflammatory arthritis, like the axial spondyloarthritis that occurs in the young people, they actually feel better when they work out and they move around. And they're worse when they wake up in the morning. Same thing with rheumatoid arthritis. When you wake up in the morning, you may have a lot more stiffness. But for osteoarthritis, it's more like you sit down, you watch a movie, or you're in a car, and then you get out of the car and it's so tight, so stiff. That's typical of osteoarthritis, but it's transient, 5 to 10 minutes, no more than 30 minutes, usually. And is there pain that wakes you up at night? And does that happen for more than 6 weeks? So knee pain at night is very common in osteoarthritis. But then if there is another kind of pain that's not allowing you to sleep, or you're waking up early in the morning, that might be something more inflammatory. And, again, as I said, pain improving with movement is more inflammatory. And what are the aggravating and relieving factors? So inflammatory versus non-inflammatory. So if you want to think like just generally inflammatory, just remember rheumatoid arthritis, non-inflammatory for sake of simplicity is osteoarthritis. So inflammatory will improve with activity. Osteoarthritis worsens with activity or with excessive sitting. Joint swelling is common in both, but maybe one is soft tissue and the other one is more bony changes. I see a lot of times the patients are really worried that my hand is changing shape, it's becoming nodular, my rings don't fit me, I have something crazy going on. But deformity can occur in both. So that's osteoarthritis will cause the same things where your joints will expand and your rings don't fit and your hands don't look like they used to. In osteoarthritis, generally speaking, your hands will not be red and swollen, like they won't be red, but that's more common in rheumatoid. Usually they won't be hot if you touch your hand or you touch your knees. It won't be hot in osteoarthritis. There's more warmth in rheumatoid arthritis. Morning stiffness is much more in rheumatoid, and fatigue is more common in rheumatoid. So if you look at this hand picture, you can see there is swelling over here, there is swelling over here. There's like deformity here, deformity there. So, but all of these are different types of arthritis. So having deformity or swelling doesn't really help you in terms of knowing what's going on. It's where the which joint is involved. So like as you can see here, this is early rheumatoid, a bit of swelling over these. These are like the knuckles or MCPs. In psoriatic arthritis, the finger becomes like a sausage. Like you can see in this finger, it's like a sausage. Late rheumatoid, you can see the fingers are all turned in one direction, that's deformed. And this is very typical of osteo, where you have like nodular swelling in your PIPs and DIPs. And this is very common and is very painful when that happens. And sometimes the pain is there for a while and then it just goes away on its own. And usually our thinking is that when there is a lot of pain is when there is bony changes. Before the nodule comes out, it's really painful. And then once the nodule is coming out and you can see the bony change, suddenly the pain may be gone. And that's kind of normal. It doesn't stay forever. So, cartilage is like this elastic kind of a band, and which is like moist and like kind of goes around your knee, and it kind of allows free motion. And then there's a joint capsule around it. And what happens in osteoarthritis is there is cartilage damage, and then the bone is exposed, and that bone exposed can grind against the other bone and cause that and sound, you hear that cracking sensation in the joint. And then you have all these bony spurs. And then, even when you look at your knees, if you have arthritis in one and not in the other, you can see like it doesn't look the same as the other side. You can have the bony prominences. You can feel it under your finger. So that's the pathology. And, you guys would know, like, any joint can be involved because all joints have a cartilage. But the bigger joints are more commonly involved, like your hips, your knees, your spine, your hands, your toes. And early on, osteoarthritis, sometimes you have some pain and then it's not there 2 days later. Later on, it becomes more of a, escalating pain, more stiffness, usually lasting 30 minutes or lesser. When you have pain, you tend not to walk, and then that can cause more muscle weakness. Then you start to notice deformed joints, reduced range of motion or loss of joint motion. So then I see a lot of people like they can't move their shoulder beyond a certain limit, and they have really bad arthritis, and really those things can happen over time. And then you can have the cracking and the creaking sensation. And not all cracking sensation is just because of the cartilage. If I do this, I can still feel some cracking here. And that's kind of normal of the like a bubble, a gas bubble kind of coming out in the joint. So not everything is abnormal. So even young people can feel the cracking sensation, and that's not because they have arthritis. There are other causes. So most of the times I see people who have a lot more knee pain and a lot of back pain. That's like a most common thing to see in osteoarthritis. So when people have back pain, they need to remember that back pain is not always arthritis. And sometimes there is the same word they use for there are many words for the same diseases. So if you had arthritis in your back, which is osteoarthritis, it can affect your disc. And then that's called degenerative disc disease. It can affect the facet joints, which is a part of the vertebra. The vertebrae are stacked on each other. And then there's a portion of the vertebra that's called a facet. And they kind of meet each other and have motion over there. So arthritis in that particular area is called facet joint arthritis. Then you have all the large muscles that go up the back. You can have muscle spasms, which may be a protective mechanism for if you have something in your back that is painful, the muscles can go into a spasm to protect your back. And that may be causing more pain. You can have, there are a lot of big muscles there, just like you can injure muscles in your arms or your legs, you can injure your muscles in the back too. And also, you know, all the leg nerves that are coming from the back. So if there is stenosis or the pressure of the osteophyte, which is the bony overgrowth pushing on the nerve, you get sciatica and those kind of issues. So back pain can be from many different reasons, and it can also occur in many different ways. It may be just pain, it may be burning, it may be tingling, there could be so many things. And so although some joints are irreversible, most patients will not need surgery. So I meant joint changes. So even if the bone looks abnormal, a lot of people can just walk on that knee forever, and not everybody needs a knee replacement. Osteoarthritis symptoms may vary among people. You may have a friend who has osteoarthritis and she never needed a knee replacement, but now you do need a knee replacement. Is someone raising a hand? Let me see. Sorry, I can't hear you. Yeah.
No, you have to unmute.
Yeah, I did. I would like to request, if it's possible, can you go a little bit slow?
Yeah, sure.
Okay,
we can do
sorry
that.
about that. Okay,
no, that's good.
You.
That's a good thing to tell me now, not at the end.
Okay, thank you.
All right. Yeah. So some of the joints changes are irreversible, and most patients won't need knee surgery. Osteoarthritis symptoms can vary among people. So you may have a friend who has osteoarthritis and needed a lot of things. They needed cortisone, they needed injections, they had to get replacement. And you may have a friend who doesn't need, just gets one injection and then nothing happens for so many years. So, you know, it's good to discuss these things with each other, but don't take your friend's experience as something that's going to happen to you, because you could be completely different. A rheumatologist can detect arthritis and prescribe proper treatments. And the goal of the treatment is to reduce pain and improve function. And exercise is an important part of osteoarthritis treatment because that will help reduce joint pain and improve function. And at present, there's no treatment that can reverse the joint damage. So unlike rheumatoid arthritis, psoriatic arthritis, we have wonderful drugs that work through the immune system. And we can literally, like, you may have a skin-covered patient with like psoriasis all over and crazy arthritis, and 3 months later you give them the drugs and everything is like 90% better. But we don't have such amazing things for osteoarthritis. So one thing to remember is if you have osteoarthritis, it's common and you'll have to learn to live with it, and you'll have to improve a few things so that you live better. We don't have any drugs that can change it. It's all about pain management and exercising and things like that. So the number one thing for everybody to remember, it's biomechanics. You know, when you have back pain, you have knee pain, think of what you're wearing in starting with your feet. Are your shoes the right ones? Are you wearing slippers at home? Should you wear something with more support? When you go for a walk, what kind of shoes are you walking with? You know, are you walking with leather shoes? Should you be wearing Keds that have some support? Do you need orthotics? Those kind of things. Strengthening a muscle will improve joint pain because a joint depends on the muscle to function. So losing weight is decreasing the load. So you have to think of all of these things when it comes to what can I do? How would I get better? Fast facts, the only reason I put this in is just because I want you to know that this is an extremely rare situation where it happens, where, you know, the arthritis is now pushing onto the spinal cord because your spinal cord runs through the vertebra, and that's a medical emergency. That's the one time that you will go to the hospital and not call any doctors. You would just go to the hospital if suddenly you have extreme back pain or extreme neck pain, you have complete numbness, you can't move, it's super numb, painful. You are touching your buttock muscles and you can't feel it. You can't even pee. So it's kind of pushing onto the what's it called? The spinal cord is being pushed and you're going to lose your leg strength completely. So that's a medical emergency. Do not wait to call a family doctor or your other doctors. You have to go to the hospital. But again, extremely rare. So this is an important slide for you guys to look at. These are the resources that I think I just found them online, and I think it's excellent for you guys to look at this at leisure. There's a thing called My Health Alberta. It's through the Alberta government. And there is the Arthritis Society. I have websites all linked into this. So if you click on it, it will take you there. And Arthritis Societies throughout Ontario, you can call them for free. You can book an appointment with an occupational therapist, and they can, they have workshops about arthritis. They can make you splints. They can give you education. So they provide a great service. And then rheumatology.org is the American College of Rheumatology website. They have excellent patient education material, not just for arthritis, but for everything rheumatology based. Mayo Clinic, Johns Hopkins, amazing websites. So there's a lot of information that you have, and sometimes it's hard to know which one to believe or what to read. Then if you just had any issue, you could open one of these things and you will know everything you need. So you don't have to search too much on Google. So the main focus of today's presentation is self-management. Nothing I tell you today is medical advice, it's just education. So when it comes to self-management, what can you do for pain? I would say Tylenol is the safest. You can take up to 4 grams a day. That's a lot of Tylenol. So you have to check the bottle you're taking and then make sure that you're not overdosing it, but 4 grams is a lot of Tylenol. And you can split it 2 or 3 times or 4 times a day. A lot of patients I see will take painkillers over the counter like Aleve, Advil, that you can get. And because they're over the counter, there's nobody to tell you not to take too much of it. But if people take these kind of medications over time, like 10 years or whatever, there's a higher risk of high blood pressure, kidney damage, heart disease and stuff like that. So although they're over the counter, short-term use is reasonable, but I don't think long-term use should be done just over the counter. You should be asking your family doctor about all those things. Then there are other pain medications, but I would let your doctors help you with that. So very common for us to be asked, supplements, what should I take? Because there's so much over there. People take glucosamine, they take chondroitin. They see, every time you go to Costco or Walmart, there's these huge bottles of like bone health and everything out there. So we have a lot of nutritional supplements, but really data for improvement in osteoarthritis is kind of lacking. So our general advice is, take it if you want it. If it doesn't help, don't, like after 2 months, if it's not helping, don't take it, it's a waste of your money, but you want to try it, go for it. Among the most widely used supplements is vitamin D and omega-3. And these two, I believe, are good. Vitamin D is specifically for all of us. We are vitamin D deficient. We came from another country. We're living in another country. We are in the Northern Hemisphere now. We were supposed to be not here. Our body does not absorb as much vitamin D, and a lot of Canadians are low in vitamin D. So vitamin D, usually 1,000 to 2,000 is recommended. Omega-3 fatty acids are good for many other things. So if you ask me the top 1 supplement, I would say vitamin D. Second supplement, I would say omega-3. And if you're vegetarian, then, your B12, maybe if you needed it. A lot of people tend to take calcium, but it's not necessary to take a calcium tablet. If you just improved your diet, you would be better off. Check the calcium calculator on this website. And it has all these foods that you eat. You can click on it. It'll tell you a number. It'll say you're deficient by, say, 200 milligrams. Then go back and see what better food can you eat to get that through the diet. It's even better tolerated when you take it with the diet as opposed to a pill. So our 2 cents is do the vitamin D. Don't have to take the calcium if you can improve your diet. Turmeric. We use turmeric every day of our lives. So we're kind of lucky that it's a part of our daily life. And I think our ancestors were very, very smart. You put it in our oil and tadka and things like that. And the way to get turmeric to be absorbed is actually in an oil-based thing. So oil increases the absorption. So for people who use turmeric all the time, it does something beyond anti-inflammation and antiseptic. Those 2 things we already knew. It increases antioxidant capacity. It actually works again for depression, helps delay aging, can lower risk of heart disease, improve brain function. It's also a fungicide. I was reading up some articles on turmeric and I was shocked with the number of things. It's like heart protective, joint protective, and things like that. So Taking turmeric is excellent, but we take it in our diet, and that's good. If you wanted to take it in a tablet form, I would usually say follow the bottle, whatever the bottle says. Go to an organic store, Fortinos, and pick it up. Take it for a month or two. I wouldn't say take it for the whole year. There is, first of all, the absorption of turmeric is very, very poor. But if you're having a flare of your osteoarthritis, or you're in a lot of pain and you want to look at some supplement, then maybe take turmeric for 2 months. You can use turmeric root in your food, and that probably is a good thing on an ongoing basis. Weight loss. I mean, so easy to say, so difficult to do. I feel that each one of us is responsible for how we want to, live, and weight is in our hands partially. It's not easy to lose. Your body kind of gets accustomed to a certain weight. So if you're obese for many, many years, it's even harder to lose weight than if you just got obese recently. So long-term weight loss, 10 to 20%, has substantial improvement in your quality of life in terms of knee pain. And that's like a direct correlation. There were studies done and they found that. So I would say to anybody I see, like, don't put on weight. That's number one thing. That's somewhere you stop. And then once you're comfortable with not putting on more, then you start to lose. And you could do intermittent fasting or time-based fasting or some other strategy. Any strategy you do shouldn't be too dramatic. It should be something you enjoy, and it should be something that you can do long-term. So intermittent fasting is people eat for 8 hours and then don't eat for 14 hours. And then they look at that 8-hour food intake and start to portion control. It's not for everybody. And do you really need to do that? I don't think so. You could if you wanted to, if you were really on the other side of, you really had to do a lot of weight loss. But if you're just trying to eat healthy and live nicer, you don't have to do amazing fasting or anything. You can just see what you're eating, do some portion control, do some exercise, and that would be good. Diet in arthritis. So diets, we all know this, refined sugars and carbohydrates can be harmful to the brain. So we don't want sugar spikes. Like, we don't want to have like a pop or like candy or, anything high sugar content, like sugar in your tea, like, and you have 4 cups of tea a day, that's going to add up to like bad stuff. And, refined sugar is absolutely like avoidable. So try not to take that. Then increasing the amount of whole grains, nuts, beans, legumes, fruits, and vegetables in your diet is extremely important. So Canada's food guide is very good. As you can see here, they have plenty of fruits and vegetables, eat protein foods, make water your drink of choice. And I'm going to play a video from here, which is really well made. Let me know if you can see it and if there's any issue, okay? It's done.
The old adage, you are
That's good.
what you eat, is really true. And research shows that what you eat has a profound impact on your overall health and wellness. And that includes your ability to cope with your arthritis. So I wish I could tell you that there was one food that would magically cure your arthritis. And unfortunately, I cannot do that. But I can tell you that healthy eating for arthritis is actually pretty simple. It's just about the same as healthy eating for everybody else. Vegetables and fruits should form the largest part of your diet. They should make up half your plate at every meal. So go for smaller portions of whole grain foods and of protein foods. Animal proteins like lean meat, fish, or dairy are okay, but in moderation. You're going to want to choose protein foods that come from plants way more often. So add lentils and nuts and seeds to your diet. Now, this approach is very similar to the Mediterranean diet, and that diet has been recommended for people with arthritis for years. Healthy eating may sound expensive, but it really doesn't have to be. You can choose frozen vegetables and fruits. They're an affordable option that keep longer, they have less weight, they contain just as much nutrition as fresh food, and sometimes they're easier to prepare when you have sore hands. Your body actually needs fat. It needs healthy fats because we need fat to help us get more energy, and fat also helps us to absorb some nutrients. But we have to make sure we choose healthy fats and we avoid things like saturated fat and trans fat. And be careful of products that are advertised as being low fat or fat free, because they may have replaced the fat with sugar or maybe salt or something else that's not really any better for you. So stick with healthy oils like olive oil, some cold water fish, some nuts, and other sources of healthy fats. If you do choose an ultra-processed food, please eat them less often and in smaller amounts, especially snack foods, because snack foods are typically high in salt, saturated fat, and sugars, or all of the above, and come with other additives. It's always better to prepare your own meals and snacks using natural ingredients and minimally processed foods when you can. When you're thirsty, drink water. It's what your body wants anyway. And sugary drinks like pop or fruit drinks offer little, if any, nutritional value. When it comes to changing your eating habits, please keep in mind that a very restrictive diet can be difficult to stick to. But by making small, sustainable changes that embrace healthy eating, you can really improve your overall health and your ability to manage and live well with your arthritis. The best way to make an informed plan for healthy eating is to consult with your physician and, whenever you can, with your registered dietitian. Have a look at the new Canada's Food Guide. That's going to offer you some great tips and some other information about portion size and healthy eating. For more detailed information and tips on living well with arthritis, please visit arthritis.com.
So just to recap, vegetables and fruits are good. Gives you the energy and the fiber you need. Orange colored vegetables, orange vegetables like carrots, sweet potatoes, dark vegetables, broccoli, spinach, kale, brightly colored fruits and veggies like berries and tomatoes, they give you nutrients. Fiber reduces CRP, which is inflammation. Lean protein for vegetarians, cottage cheese, eggs for people who eat eggs. Healthy fats is cashews, almonds, fish, seeds like walnut, flax, olive oil, canola oil. These are all healthy choices. Should you exercise? I think that's a good question for a lot of people. When you are in pain, your joints are hurtful and swollen, should you be doing your walking that you usually do? Should you not be doing that? So the benefits of increasing physical activity. Did you know you're feeding your joints when you're active? The cartilage depends on the circulation caused by joint movement to stay hydrated, absorb nutrients, and remove waste. Just like you need sleep, you need to move. Cartilage, ligaments, muscles, and bone become stronger and more resilient with regular exercise. So exercise is a very amazing thing that we are able to do, even if we do it in small quantities and for like a short duration of time, the health benefits are a lot. And for people who can't walk for 30 minutes at a time, I would say maybe do 15 minutes in the morning, do 15 minutes in the evening. Always start slow and then go up. If you haven't done any exercise for a really long time, start very slow. If you think you can do 5 sets of something, just do 2 and then build it up. So what does exercise do? It increases our range of motion. It improves our pain, improves the strength of your muscles and ultimately your joint, improves your mood, improves your balance, which is what you need to stop from falling and preventing fractures. The more active you are, the more people you will meet, you will socialize more, you'll have a better quality of life, and it improves chronic diseases. So it's not just about the joints. Our joints are just a part of our body. We have to look after our heart, our overall health, and all diabetes and all those things. So the more energy you burn, the better you'll feel. And what kind of exercise should you be doing? So this is from My Health Alberta.
When you have arthritis, it's easy to think that exercise will make your pain worse. But the truth is that exercise can actually help your joints feel better.
I was afraid I might damage my hips, but since I've been exercising, my hips don't ache so much. And I've even lost a little weight.
I started doing leg exercises for my knee. You know, it feels better and stronger now, and I even have better balance. I'm not so afraid of falling when I play with my grandkids.
Arthritis in my back was really slowing me down. So I started stretching and walking with a friend. It was kind of hard at first, but we kept at it. And now I'm starting to notice that it's easier to do things around the house.
Exercise can help arthritis. Here are some tips to keep you safe and help protect your joints. Activities that get you moving are important. Things like walking, bicycling, or swimming. But it's also important to stay flexible and build your muscle strength. So be sure to do other exercises like stretching and lifting light weights. Ask your doctor which exercises would help you the most and which ones you shouldn't do. If you haven't exercised for a while, start out slow and do a little more each day. Do what feels good. If your knees hurt, take a swim instead of a jog. If your hands hurt, don't do anything that requires a grip, like biking or tennis. If exercising makes your pain worse, ice the sore area. And think about taking your arthritis pain medicine before you exercise. It can help prevent pain afterwards. Be sure to tell your doctor which pain medicines you're using and always take them exactly as your doctor or the label says. And remember, if an exercise makes your joint hurt for more than a day or two, it's time to rest, slow down, or try something new.
So coming back to, did you over-exercise? Listen to your body. If you have had an increase in your joint pain after an exercise or an activity greater than 2 hours after, then you've overdone it. Cut back. You shouldn't be in pain after 2 hours of exercise. Some muscle discomfort is to be expected if you haven't worked out for a while, but not sharp pain. Your pain and your muscle discomfort that you start when you're doing something new should improve after 24 to 48 hours of normal activity. If you're still in pain after 3 days of an exercise or whatever you did, that's not the right one for you. So in our, usually for patients with osteoarthritis, who have knee pain, back pain, one of the best exercises was being in the water and doing aquafit. But with COVID, it's kind of cut back, like it's impossible to do all of those things. So one of the most important things I learned from my patients, I'm always learning what's working from them, and then I'm trying to pass it on to the next one, is they wake up in the morning and they start to do their stretches right away. 10 minutes of stretches in the morning kind of makes you feel much better throughout the day. So maybe that's something, if you haven't tried it before, you do some yoga, do some back stretches, arm stretches, just some mobility, bending forwards, backwards, and moving your shoulders. That's a good workout for 10 minutes. Next question they asked me is, should I use ice or should I use heat? What do you guys think? Ice or heat? I think only, what do you guys think?
Depends.
Depends?
Yeah.
So what's your go-to if you are in pain?
I think heat.
Heat? Okay. Again, I think that right answer is it depends on what's hurting you. If you sprained it, then you probably put ice. If it's like a chronic thing, then you could, use both. So let's see this video. So all these 5 videos are really good. I'm going to just play a couple of these, but the rest you can see.
Arthritis makes your joints feel stiff and sore, like they're locked in place or even on fire. But using heat and cold can help with the pain. To use heat, place a heating pad or hot pack against the sore area 2 or 3 times a day for 20 to 30 minutes each time. A hot shower can work too. If you use an electric heating pad, be sure to set it on low or medium, not high. And don't fall asleep with the pad on. To use cold, try putting a cold pack, a bag of ice, or even a bag of frozen peas or corn on a painful joint for 10 to 20 minutes at a time. Whatever you use, don't put it right against your skin. Put a thin towel or pillowcase between the ice and the sore joint. And if you refreeze and use the bag of peas or corn again, mark the bag clearly so no one uses it for dinner. Another good way to use cold is to give yourself an ice massage. Fill a paper cup with water and put it in the freezer. Once it's frozen solid, peel the top part of the paper cup away to expose the ice. Hold the cup in your hand and rub the ice in small circles where you have pain. Use a towel to catch the water as the ice melts. Avoid bony parts like the top of your kneecap and the pointy part of your elbow, and keep the ice moving. As the ice melts, keep peeling the cup away to expose more ice. The area will feel cold at first, then it may burn, then ache, and then finally become numb. Your skin will be pink and cold when you're finished. Do this for 7 to 10 minutes, several times a day. Switching between heat and cold can help too. Try using heat, then a few hours later, use ice. Experiment a little to see whether using heat, cold, or both works best for you.
So now this is a fun question. And let's see how many takers for how do you sleep? Stomach sleepers, back sleepers, or side sleepers? So yay for stomach sleepers. Who's that? Nobody? Back sleepers? All right, much more back sleepers, I see. Side sleepers? Few side sleepers? All right, let's see what the posture is for sleeping. So for sleeping, we want our spine to be straight on. And back sleeping is very good for your back. Generally speaking, when you have back pain, that's one of the best postures. But if you're a side sleeper, make sure you're not sleeping like this. You know, you need a pillow that kind of takes the curvature of your neck and your feet are straight. Your knees are straight. Some people like to use a knee pillow because, you know, when you have painful knees and your knees touch each other, they can be more painful. So a good sleep posture, just like when we are standing and walking, we want a good posture. We also need a good sleep posture. There's like a lot of things on like, you know, what kind of mattress should you be sleeping on? Should it be firm? Should it be soft? So it should be not too soft because your lower part of the body is heavier than your upper part. You shouldn't be like sinking into your mattress, but it shouldn't be too firm either. So you'll have to find the right one that works for you. And same thing with like neck pillows, you know, what kind of pillows do you need? Do you need a one which is U-shaped? Do you need something that is soft? Definitely don't need a high pillow because that's no good for your neck and your shoulder. So standing up, I just want everybody to stand up who's able to stand up right on their own, which I think most of you are. You're actually all in good shape. And for those who have trouble standing up, I'm going to show you how to stand up. Okay, so let's see. Oh, 1 second. I think it's anybody who has trouble standing up? Anybody has trouble standing up should stand like this. Let's see this guy standing up. Try this technique even if you're not in pain.
Avoid straining your shoulders when trying to stand up from sitting. Instead, move to the front of the chair, place your hands on your legs, and stand up from the knees. For low chairs, give yourself a head start by sitting on a raised cushion. Use bed blocks under sturdy furniture to raise them up.
It's literally as simple as that, right? Just kind of push yourself to the front of the chair, put your arms on your knees, and then you can stand up. I think most of you are pretty good, but you know, some people really have a hard time getting out of the chair. And instead of going and buying new furniture, you can literally push your chair up with blocks at the bottom so that you're raised, right? So driving, a lot of you guys drive. I'm sure most of you drive. Just a quick video on how to make the most of it and, you know, feel better when you're driving.
Hip and knee pain can make getting in and out of a car difficult. Try backing yourself into the car. Sit down, then swing your legs into a forward-facing position. Do the reverse to get out. A car transfer handle can provide greater stability and balance when getting into or out of your car. Sheepskin or memory foam steering wheel covers provide a comfortable grip and protect hands from cold temperatures. Wearing a pair of leather gloves can also help. To make turning your gas cap easier, keep a non-slip jar opener in the car or try a gas cap opener. Check your car manual to learn all the ways your car is adjustable. You might be surprised by some features that can make driving more comfortable.
I had back pain once and I had to get out of the car just like that. So I appreciate these videos. Not sure if anybody here uses a cane. Does anybody here use a cane?
Some people.
Not really, right? But if you ever needed a cane and you had to use it, remember a few things, okay? There's lots of canes out there, right? There could be the one with a single tip at the bottom, or a like a quad trip, which is like four at the base. The one with 4 at the base is a bit more to manipulate, a little bit harder to move with. But if you have serious balance issues or somebody's recovering from a stroke, then probably the quad trip is what you need. Otherwise, a single tip is usually all right. You see the angle of the elbow and the cane. Normally, it should be like a 15-degree angle. So the height of the cane should be such that your elbow rests at about 15 degrees. It shouldn't be too straight or like 90 degrees. Like it shouldn't be too tall or too high. And the second thing you need to see is the cane, the grip should be at the level of your wrist. So like over here, this is where it should come to, the height of your cane. When you're holding it in your hand, it should rest over there. So that's the first thing when you go to buy a cane. And I mean, with technology, it's so much nicer. You can have a cane that goes up and down and, so you don't have to be too worried, but at least you know how to adjust it. And this is important for you to know. If you're using a cane and say you have knee pain in your left knee, how are you going to use your cane? You're going to use the cane in the right side of your body. So you're going to use it in the right hand because now you're going to compensate for the left knee pain. So your cane should be held in the hand opposite your weak or painful leg. Move the cane in unison with the affected leg. So when your left leg moves, your right cane moves. Each time you step with the affected leg, move the cane too to give you support as you walk. When you step forward with the unaffected leg, keep the cane in place. The cane does not move when you're moving your good leg. And, I've been asked so many times, like when I walk up the stairs, what do I do? And I'm like, I don't know. You need to ask a therapist what to do. But thanks to you guys, now I know what to do. You have to use the cane like this when you're stepping up. Be careful when using steps with a cane. If you have an injury or a disability affecting one leg, grasp the railing if possible and step slowly and step up with your unaffected leg first. So if it's your left leg that's hurting, you can see you're going to put your right leg up first and then step up with your other leg as you move the cane. And the cane always moves with the bad leg. To move down steps, put your cane on the lower step first, then your affected leg, and then your other leg, which carries your body weight. So I'm sure if ever you need to use a cane, a lot of it is also intuition, but it's good to remember that you're going to do the, somebody raised a hand here, is it? I'm not sure. Somebody want to say something?
She has to unmute herself.
When you were showing the best postures for sleeping, I wanted to know what the good postures or what the better posture when you sleep on your back? Is there some video or any picture?
I don't have a video or a picture, but the Arthritis Society has a lot of stuff on it. Like there's like over 100 videos on that. But, you know, basically, if you're lying on your back, you're going to, again, sleep straight, of course. You're not going to bend your knee and all that. You're going to sleep flat. And your pillow should be such that your neck curvature is not too high or too low. It's like flat. So a straight posture. Okay. I'm sure there's like a lot more out there. But basically, you want to keep your spine straight. Okay.
Yeah. Sorry, that's when I put my hand up.
Oh, is it? I just saw it right now. Yeah. Sorry. Okay. So now this is very important, you know, bathing, washing as we get older, you know, things happen. What are the changes we can make in our, you know, some people are renovating their homes just, you know, for aesthetics. But now as you're getting older, you might as well make it such that another 5 years, if you needed something, some supports, then you'll have it out there, right? So when you make some renovations just for fun or because you need them, make sure you up-to-date them for your future life, right? If you're going to remain there. So let's have a look at what can be done.
Washing and bathing are important parts of our daily routine. Try these hacks for safer, more comfortable bathing with arthritis. To make turning your taps on and off easier, choose a lever tap or use a washcloth to help you grip. Safety while bathing is important. A non-slip bath mat can help provide grip and prevent falls. To help you get in and out of the shower or bath, grab bars or safety rails can provide extra support. A bath seat can help you maintain balance and ease pressure on your joints. Choose a seat with adjustable legs and rubber tips or suction cups on the bottom. For people who need extra stability, a backrest and arm supports may be helpful. If it's difficult for you to move in the shower, a detachable shower head can give you greater control for a full body clean. It can also be helpful if you need to sit while showering. A long-handled sponge or brush can also make it easier to clean hard-to-reach areas.
So gardening, I think a lot of you must be gardening, and we all love to garden here because we only get 6 months. We want to do it all together really fast, and then it hurts. So remember, when you're going to be gardening, you want to plan ahead, warm up, start slow, you know, start with half an hour to 1 hour at a time, and then pace yourself. Light loads, bring into your garden, get somebody to help you to bring things in for you, change your tasks, cover up, protect your joints. And, you know, if things are a little difficult, too heavy, too big, or just too time consuming, get somebody to help you. And have a look at this one. I think this was a really good, sorry, 1 second. What did I do? Sorry, where did I go? I think I messed my windows. Give me a second. All right, so it looks like that video didn't actually attach there, but there's a video for gardening. Oh, watch this video. It's right here. Sorry. It's gone somewhere. It's a good video.
Arthritis pain can sometimes make it difficult to do the things we love, but these helpful hacks will make it easier for you to keep up with your favorite hobbies. A garden stool can help relieve pressure on your hips and knees. Avoid kneeling if possible, but if you need to, look for a stool that switches to a kneeler. Choose a lightweight host to reduce strain on your arm and hand joints. If you prefer indoor activities like playing cards, a card holder can reduce finger joint strain by decreasing the amount of force required to hold them. A book holder eliminates the need to hold your book or electronic reading device in the same position for a long time.
Lifting, be careful when you lift. Don't lift anything heavy. Definitely not worth the energy and problems that may happen because of that. Get help. Maybe if there's, you need to do something heavy, get two people to do it for you, or you do it with your wife. Just don't do it alone. Think before you're lifting, is this possible for you to do it alone? Keep the load close to your waist. Adopt a stable position. Make sure you have a good hold on something that you're holding. Do not bend the back any further while lifting the load. Don't twist and turn when you're lifting, because that would be a problem. You can have a spasm and pain after that. Look ahead, move smoothly, know your limits. If you're not happy with what you're holding, it's better you just keep it down than to try to finish it, and then restart it again. So don't hurt yourself, because a lot of stuff that people do is kind of preventable. Like it's really snowing outside and then you go out for a walk, or you're shoveling and you slip and fall, or you're like just bringing some groceries in and you slip on the staircase or just outside the house. That's such a common story. So make sure that you look at the weather when you're going out and doing things. Fall prevention, use a non-slip bath mat, remove loose rugs. Consider installing a grab bar. Keep your home clean and clutter-free to prevent tripping. Very important for everybody is to store items where they can be reached. Don't put something on a shelf that is really high and then you have to take like a ladder to climb up. Live small, live simply, keep things around you, and don't have to have 5 of the same thing. Just keep one thing that's easily accessible. And have things that are meant for you. There are maybe some items in the house that you can't use anymore because the pan is too heavy. La Crosette looks great, but is this the right one for you to have to hold such a heavy thing and wash such a heavy thing? Maybe not. So then give up on those goodies and just buy something that is more right for you at this point. Winter tips, like we all don't like to be out here in winter. Kind of everybody wants, at least I want to go back to India and enjoy the sunshine, but it's not possible. You're going to live here. We need to live better in winter. What are we going to do about it, right? Enhance your mood. How do you do that? Exercise, right? 10-minute warm up. Change your exercise pattern every day. There's so many videos on YouTube. You can kind of choose 1 or 2 people you enjoy seeing and then keep changing what they're doing. You can do abs one day, arms one day, back one day, yoga one day, Pilates one day, body flow. There's so much. Like people who like to dance, you can do like slow music, dance with your husband, do some Zumba, do anything, but do something. And that's your half an hour a day. And always do like a warm up and a cool down. Group exercises, you should meet your friends online. I do that with my friends once a week. A few of us meet up on Zoom and then we start to do some exercises or yoga or Zumba, whatever we want. You have such a beautiful Maharashtrian group here. Like, it's good you're doing this once a week or however often you're doing it, but you could totally have like an exercise group going, one day of the week, you guys can meet up on Zoom and start something that is enjoyable for everybody. Keep warm, avoid falls. Make sure that at night you have some dim lights near the washroom and the lobby. Have support bars, don't have any loose carpets. If you need to walk up and down the staircase, go really slowly. There's never a rush because you are not in a rush. You do not want to fall. Just respect your body and respect your age and just take things smoothly, Enjoy that retirement, enjoy that smooth lifestyle that you have. If you need to shovel the snow, use a snow blower. If you have to use, the thing with the hand, then don't try to hold the snow in your arms and then shove it off. Just push it on the side. You don't want to take that heavy weight on you. My 2 cents to you is look after yourself. That's the number one thing you need to do. And it's not just your joints, it's everything around you, everything that is for you. So I always tell my patients, if something's bothering you, our job is as a doctor is to tell you a thing about your A problem, and we can help you with that. And that's it, right? But you have B, C, D, E, F, G that you need to look after. So look at yourself as a whole. Sit down and say, okay, how's my mental health? How can I make it better? Maybe you're amazingly happy and that's great. But if you're not, what can you change, right? Sometimes with this isolation, being alone at home, all of those things can, over time take a toll on you and you don't realize how it all started. So socialize, be happy, de-stress, meditate, do your pranayam, And if you have some depression or some anxiety or some problems, talk to your doctor. There's cognitive behavioral therapy. It's not just about taking more medications. It's about trying a holistic approach to improvement. Think of your physical health, right? Are you walking enough? Are you exercising? Is your house safe? Are you sleeping well? Sleep is the number one thing that, a lot of people don't sleep enough, and that causes issues with fatigue, that causes more pain, that causes more disability. So you want to make sure your sleeping habits are good. And it's not, again, taking a Zopiclone or a lorazepam at night to sleep. We don't want to give you tablets. You shouldn't be taking tablets, try natural things. Heart health, like I'm just putting heart because everybody loves the heart, but it's generally overall health, right? Make sure your weight is under good control, your cholesterol is okay, your blood pressure is okay, you're not fat over the abdomen because that's a higher risk of heart diseases and cardiac risk and risk of stroke. Make sure you're doing all the right things for yourself. From a bone perspective, it's just not about arthritis and pain, it's also osteoporosis, vitamin D, are you exercising, good balance, avoiding falls and fractures. So just look at yourself, sit down and say, I'm happy in all of these aspects, or I'm not happy here. And then think, what can you do? And make small steps, take small steps to reach your goal and have your own goals. There is no right answer to your goals. Like, just think, set your goal and give yourself enough time to reach that goal. Don't push yourself. And this is just a thing about, when you see your doctor, what is it that would make your appointment with your doctors really useful or efficient? Would be if you had a list of all your medications, what medications you take and what dosages. So whatever blood pressure medication, amlodipine, 20 milligrams a day, that's it. Like, just make a good list, like write it down on a piece of paper or print it or whatever. So when you go to your doctor's office, you don't have to waste your time on all of these small things that should be just like, here it is, or you give it to this, kind of make it efficient. So you have a short period of time, make sure you have questions that are ready. Whatever allergies you have, keep it like handy. List what treatments you've done for your arthritis. Have you done physio? Have you done massage? Just kind of keep it handy, because it's important for the doctor to know what all you've tried before you come there, so that they know what else is left to add to that. Make notes, or, take a person with you. Some people get, when somebody's talking to you in a doctor's office, it's so many things, right? It's hard to remember what they all said. So sometimes it's good to have a person with you. Like,
आता आपलं सिनियर्सचं झूम चाललंय.
So
सिनियर्सचं झूम आपल्या मंडळाचं मुळगुंदांचं. ओके, जॉईन कर मी बघते आता.
लीना प्लीज म्यूट yourself. लीना प्लीज म्यूट yourself. प्लीज म्यूट yourself. म्यूट कर, तुझा आवाज नाही येत इकडे, ते म्यूट कर. Okay.
So I just want to tell you guys that we are all in this together. You may be in your, I may be in my whatever age group. I also have pain. A lot of us are going to be in the same boat all together. So it's good. We are all together. We can do something better for ourselves. And doing it together with your friends will make everything much more enjoyable. So that's pretty much the end of my presentation.
Okay.
Let me see. Thank you for your attention here. And I have this app that I made for my patients. So a lot of us use it. There's a QR code at the end of it. You can just download it and use it. It's free. I don't get any information out of that one. It just sits in your phone. The only thing is, I do a lot of inflammatory arthritis. So my special interest is rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. So when I made this app, those are the 3 diseases I focused on. So if you scan this code and you download it on your device, you will have to choose one of these diseases to be able to use the app completely. Maybe in the next year or so, if I have the time and energy, I will add osteoarthritis on top. But right now, if you want to use it, you can put any disease, just say put rheumatoid arthritis, and the scores are there. It's basically quite generic. And you can keep your own diary in it. So all the things I'm telling you, have your medication list, have your health history, it'll allow you to keep a record of everything: height, weight, medications, allergies, symptom journal, pain, sleep, fatigue, mood, everything. So it's like your little diary in your pocket on your own phone or whatever. So use it if you like it. And I'm open for any questions you have.
Can you take your screen sharing off?
Yes, I'm going to escape all of this and get me out of here.
आपण तसं करूया की जर तुम्हाला कोणाला प्रश्न हवे असतील तर तुम्ही तुमच्या रिॲक्शन्स मध्ये हात दाखवा आणि मीना जातेगावकर शी विल मॉनिटर दी ऑल दी हँड्स and invite the people to ask the questions. Meena, you're on. कुणाला प्रश्न आहे?
नाही, कारण मनीषाने इतकं छान सांगितलं की काही प्रश्न नाहीयेत, मला तरी नाहीयेत.
Actually, Manisha, videos were excellent. कारण छोटे जरी असले ना तरी it said lot more than what you intended in the words. So it was really good.
That's good. That's good. And those websites are amazing. Like I looked at them over the last couple of weeks, and I'm like thankful because now I know so much is out there for you guys.
There was one question in the chat that I saw. That somebody was asking what is the best way to cool down after the exercise, and I had that question too. So if you
depends
can
what exercise you're doing, right? So if you are like on the treadmill or like anything that's cardio, so it's like if you're walking at 6 or 8, then your cool down is at a 2. Then just walk for a couple more minutes, right? Okay. For me, cool down is usually like doing some stretches, whatever exercise. If I run or I jog or whatever I do, you do your stretches. That's your cool down. You do your poses, you do your back stretches, you do your yoga stuff, right? Your arms and your elbows, those things. That's your cool down. So anything that you continue to exert, so exercise, don't stop like cold turkey, like you did a lot and then you just come down and sit. No, do your stretches. Even that's a cool down. So depending on what you're doing, you can just go slower on the same thing, or you can just finish your stretches.
Okay, that sounds good. Thank you.
Somebody has a hand up. I don't know.
Susham, मला विचारायचा प्रश्न.
Go ahead, Sushma.
Yeah. Manisha,
yeah.
Thank you for your presentation. Wonderful presentation. Very practical, particularly for our age group. मला प्रश्न आहे की you said acetaminophen, Tylenol, you can take up to 4,000 milligrams per day.
Yes.
Is it the same for our age group or?
So unless you have some issues, like usually it's 4 grams is like standard, but nobody takes 4 grams. 4 grams is a lot, right? So most people will take like 2,000 to 3,000 milligrams a day.
Yes.
But standard is 4,000 milligrams. You have livers, like generally speaking, 4 grams is like standard.
Okay. Because there was, for a while, there was a concern about they had decreased the dose of acetaminophen to less than 2,000. And this is the first time I'm hearing that the dose has gone up to now 4,000 years.
I don't think there was ever a thing about less than 2,000 or anything like that. Standard, all our hospital admissions is like 4,000.
I'm talking about a few years ago. There was a decrease. So now it's 4,000. Okay.
Yeah. So, and as I said, if you're already taking like 2 Tylenols, like every 6 hours and you've taken like 2,000-3,000 already, then there's no point making it 4,000.
Yes.
It's not working.
Okay.
Got to think of something else. Yeah.
Thank you.
Manisha, but I'm sure that there are different types of Tylenol over the counter, like extra strength or Tylenol specifically for arthritis. So that would make difference, wouldn't it?
That's why you have to look at the milligrams, right?
Milligrams.
So if it's 500 milligrams, then of course you can only take 8 maximum. If it's 325 milligrams, then you do your math, right? If it's extended release, then you're not going to take it every 4 hours. Then you probably, even if you want to take, you have to take it every 8 hours. So it depends what formulation you're taking, but thumb rule is like, because the problem I see, at least in my practice, is people taking Advil and they take like 2 Advils every 4 hours, right? That's a lot of Advil. It's going to shut down your kidneys or something. So that's why we say, forget your Advil. First, you escalate your Tylenol to like a 2-3 grams, whatever. Then you can take an Advil once in a while, or don't even take an Advil. Go to your doctor and say, it's not cutting it, and let him decide what to do.
Okay.
ओके, मग आपले लोकांचे प्रश्न विचारून झालेले आहेत. तर डॉक्टर अशोक वार्देकर, I will invite him to give our wonderful speaker a vote of thanks. Wardekar?
Yes, I have been given this task to thank Manisha Mulgund, Dr. Manisha Mulgund, and it is a pleasure that you gave this talk to us in a very simplified manner and very clear-cut instructions with a lot of illustrative videos. So from all the members of this senior forum of the Marathi Bhashik Mandal, you have our heart full of thanks for giving us such a wonderful talk in such a brief period, making things quite clear-cut with a lot of illustrative videos. And we look forward to having such talks from time to time on different topics from you. I just wanted people to understand that when they say rheumatologist, it is not arthritis. Rheumatology is a very wide field. It affects practically any part of the body, from heart to pericardium to the lung to the pleura to skin, eye, kidneys, and you name it. So it is a very, when they say rheumatologist, it is not only arthritis they deal with a very complex inflammatory process and disease. So, so it was very good, and thank you very much again for giving this talk to us.
Oh, no, pleasure is totally mine. Thank you so much. And I wanted to come on that part because rheumatology is so wide with autoimmunity and, rheumatoid arthritis affects like any part of your body. A lot of times we have patients with osteoarthritis and they want to keep seeing us. And we're like, no, you don't need me. You don't need me.
Exactly.
For me, the reason I see people with osteoarthritis is to teach them. So because then once you know what you can do and what we need to do, then they're really very good with the family doctor. But a one-time thing is a good thing. And I think you should all thank Mr. Sriram Mulgund because he has been amazing at telling me what he wants out of this presentation and how he wants it done. He's totally on the top of his game. And that's great. That is amazingly, I'm like super impressed.
So what I will do, I will get this handout from Manisha and I'll put it on my Gmail and I'll send you the link so that you can pick it up from there and just copy it there. So because she has given a lot of information to us. So if you have a printout at home, you can always look at it. And I think Manisha, from that handout, people can use those website addresses and go
Yeah, you can like click on that file and it'll take you to the website and you can read a lot.
So please send me the.
I'll do that.
And then I'll circulate to everybody.
Thank you, everybody. It was great meeting you all.
Thank you.
Wonderful. Thank you, Manisha. My personal thanks to you.
Thank you. Bye.
Thank you.